Not bad. Not bad, right? Although, unless they got people else. No, but you're by and large, I'm an better. Right then. Being on the ground there.
Hi, everybody. Welcome. I'll invite folks to start getting settled in their seats. I'm sure, this time of year, as we're getting towards finals, we'll have students sort of coming and going as their classes let out and they get in. So I am Shannon Hayter. I'm the Dean of the School of International Service, and it is really my pleasure to welcome everybody here for today's event. We are honored to host the senior leadership from the U.S. Department of Health and Human Services to launch their new global strategy. And it is really a privilege as SIS and as SIS's new Global Health Policy and Practice Initiative to be able to bring you all together for this here. For those of you who don't know us here at SIS, we are a unique place. SIS was founded in 1957 as an interdisciplinary school under the premise that it takes bringing people together from not just different disciplines, but different perspectives in order to really take on the world's biggest problems with the most creative solutions to make an impact on people. And so as we offered to host this launch, it was very telling that I was educated over and over again that this is not a global health strategy. This is a health and human services global strategy, which I can only tell you resonates so much with the people in this building. Because I think even when we talk about health, we don't think about health without thinking about, and how does migration interact with that? How does culture interact with that? How does climate interact with that? How does politics and governance and political will interact with that? How does economic development and resources interact with that? And so I couldn't think of a better and more fitting place to be able to welcome you to hear a lot more about this vision of the future. And so we'll hear shortly from HHS Assistant Secretary for Global Affairs, Lois Pace, who will share perspectives on current and potential global health threats, the innovation, the diplomacy, the strategic vision necessary to solve these challenges through an equity and sustainability lens. Justice, health justice, climate justice, also part and parcel of what happens in this building every day. And of course, also the important role of U.S. leadership in achieving these goals. So HHS has built global coordination into its approach for more than a century and currently has 7 health attachés, many of whom are here with us today. So raise your hands if you're one of our visiting health attachés, please. Thank you. Stationed around the world. We have folks in the room today, as I mentioned, representing India, Kenya, South Africa, and Switzerland or Geneva. So you'll hear a little bit more about this later. And addressing global challenges certainly requires a coordinated effort that creates space for innovation, for collaboration, for strategic and effective responses. And I, for one, can't wait to learn more about the Global Health and Human Services Strategy and implementation this afternoon. So before we begin, I want to thank Kaya Lewis-Atkins, who is the Chief Advisor for Policy and Strategy in the HHS Office of Global Affairs, for bringing us the opportunity to host the event. Our distinguished speakers, including Julia Lamage, Amy Lin, Andy Frietz, Susan Kim, Matt Lim, Savia Siddique, Janessa George, and Desmond Williams. I want to thank our SIS team, Alice and Allison, for helping to make this happen. And I want to recognize our Department of Environment, Development, and Health Chair, Lauren Carruth, in the back there, who is, of course, shepherding this Global Health Policy and Practice Initiative. I also bring greetings from Sylvia Burwell. Those of us from AU know her as our past president. Those of you from HHS, I hope know her as Madam Secretary. She couldn't be here today because she is in a previous secretary's lunch, but certainly was so thrilled to hear about this milestone, and it is so aligned with her commitments and vision for the world that it was just a thrill for her to know that you'd be joining us to launch your strategy. So to kick off the program, we're going to kick it off with a fireside chat between Assistant Secretary Pace and Alyssa Jones, who is stepping in for Deputy Secretary Palm, who couldn't join today. So Alyssa Jones currently serves as a Senior Global Advisor in the Office of the Assistant Secretary of Public Affairs at HHS. She has worked across HHS, including in the Office of Refugee Resettlement and at the National Human Genome Research Institute. She is a returned Peace Corps volunteer, having served in Morocco. This is also a building with a lot of Peace Corps dedication. We were one of the top schools who feeds in Peace Corps volunteers since its inception. And prior to her government work, Alyssa led communications and VIB services in the fashion industry in New York City for almost a decade. Assistant Secretary Pace is responsible for advancing the U.S. international health agenda and human services agenda through multilateral and bilateral forums. Reporting directly to the Secretary of Health and Human Services, she is the Office of Global Affairs lead on setting priorities and policies that promote American public health agencies and interests worldwide. She oversees HHS's engagement with foreign governments and international institutions, as well as policymaking bodies such as the G7, the G20, the United Nations General Assembly, and the World Health Assembly. Previously, she served as president and executive director of the Global Health Council and was also a member of the Biden-Harris Transition COVID-19 Advisory Board. Assistant Secretary Pace also spent over a decade working with community-based organizations and grassroots leaders in countries across Africa and Asia on campaigns calling for person-centered access to health. Additionally, she's held various positions in a range of global and regional advisory committees and boards that focus on equity and inclusion. So without further ado, I am going to turn this over to Alyssa and Secretary Pace.
Hey, thank you. Thanks for having us today. We're really thrilled to be here and to be able to start this conversation followed by our panels. And we're really hoping that this is a dynamic dialogue and everyone gets a lot out of it today. So Assistant Secretary Pace, we started a bit with your bio, but you grew up in Los Angeles. You have degrees from Stanford and Johns Hopkins. You've worked in over 15 countries with, I'd say, friends and relationships in probably every single one. You speak Spanish fluently, conversational in French and Japanese, and enough to get directions and order a meal and many others, I know.
Possibly, yes.
And you're the first woman of color as the Assistant Secretary of the Office of Global Affairs. So a variety of things in your background, which is great for a place like HHS.
Indeed.
So to start, can we talk about what does HHS do in the global space? Is there anything from that work that you think would surprise people about HHS's global work?
Yeah, no, I really like this question. Actually, when I took on this job, it's my first time in government. And when I took it on, I think people were surprised to see me go into a place like the Department of Health. And I'm thinking, of course, I'm going to be with all my nerds, in the health space. But actually, I was also excited to do it because I knew how much HHS did in the international realm. And I was excited to tell this story. So we have a number of agencies within our department, almost all of which have some tie internationally. They're not all doling out grants or sending staff abroad, but they have a connection to people around the world. And that's because people around the world have a connection to us and the work that we do. Some surprises, I think, for perhaps some folks in here. And I'm so excited because I see faces that I recognize. It's good to see all of you friends here and perhaps online. But there is an administration that covers substance abuse and mental health. People might not realize that in addition to having conversations here in our country about the opioid crisis or challenges with suicide amongst adolescents, those conversations are happening abroad and we're having them with people around the world. Our Surgeon General, our administrator of that particular agency, they field calls all the time. And they're not just helping others, but they're asking for help. They're asking, well, what are you seeing and what are you doing? We also have our Indian Health Service. Again, they're doing amazing work, incredible work across our country and including an Indian country, and they're working with Canada. and Australia and other places with indigenous populations. Brazil has questions about what we're doing to address health in these communities. And so I feel like those can sometimes be surprises. You hear about the big agencies like our Centers for Disease Control and Prevention, which will be here later, and our National Institutes of Health. But there's so many other parts of our department that really do a lot to serve America and the world.
So a lot of work is being done. So there's a lot to keep on track. So we need to make sure that we're strategic. We need to make sure that we're effective. So we need a guide. I think that the greatest guide that we can have is the new HHS Global Strategy. Can you give us a little bit of background on what the strategy is and how you see it helping us to be able to implement our work globally?
Well, I hope everyone's read it cover to cover by now. It just dropped just yesterday. So, talked about it around your dinner table and whatnot. There are a few parts, and I also want to credit dear Kaya Lewis Atkins for captaining this ship over the past year or so, in addition to her other duties in her office. But we worked across the department to really try and understand what we collectively see as priorities. The good news is we were on the right track. The last time we had a strategy was 2016, so about a decade ago. And guess what? Issues like global health security, still important, it turns out, and particularly in the wake of COVID. And so we spent a lot of time really drawing from those lessons and trying to update the strategy when it comes to preparedness and response initiatives or activities. But it was also, as Dean Hayter said, really important for us to look across the health and human services spectrum and ensure that we were inclusive of those priorities as well, particularly as the world has evolved in other ways to address the linkages between climate and health, for example, or really look to technologies, in digital health, in particular issues like artificial intelligence and the need to not just innovate, but regulate in that space. And so that is another important and probably the chunk of our strategy, right? Looking at sort of A to Z, what we're doing across the department in health, and again, looking at how that work is applied. And then principally important for us was to centralize equity. This is something that I think many of us, particularly in the health space and certainly in the international space, have come to appreciate is key. It's not just a moral imperative, but frankly, a strategic one. And I think as a data geek, we look at the data, we look at how far we still have to go. And oftentimes that gap we're able to bridge by focusing on the equity agenda and really clarifying who is being left behind and focusing our efforts on those people, on those communities. And so we have come in, just as our president and secretary have done, unapologetically to make equity a cross-cutting objective and ensure people understand how we are implementing equity, right? It's not just a tagline or a headline. It's something that we're trying to demonstrate and articulate every single day in everything we do.
So across your experience, and definitely as Assistant Secretary of Global Affairs, you've been a part of many different types of global meetings, from very formal multinational meetings to field site visits to see HHS work firsthand. And you've been to nearly every corner of the globe. I believe in the last month, you've been to Rio and Malawi in 30 days. So definitely getting your airline status.
Correct.
But in a digital world where we can jump on a Zoom call at any time, what makes these in-person interactions so impactful and necessary to the work that HHS does?
Yeah, it's funny. I've been at this a while now, all told, and I did not get into this work for the miles, certainly. I made a lot of friends on airplanes, but I can do without it. And there was a time I asked myself this question: am I doing too much? Are we showing up too much? And believe me, with the climate and health agenda, we can actually be more efficient in how we come together around the world. But what frankly this team and this time has helped me understand is the value of personal connection, particularly for people who haven't spent their careers doing this. And so you look at someone like Secretary Becerra or Deputy Secretary Palm, who, of course, in their previous tenures, whether in Congress or in the department, have seen parts of the world, have worked somewhat in this way, but they have huge portfolios that have them busy doing plenty of other things. So while they can pick up the phone or send an email or a letter to someone around the world to try and, achieve this diplomatic goal that we have, it's much better when they're able to show up and sit literally at the table with someone else, or even break bread with them and really connect with someone on a human level, on a personal level. Not just that, but getting outside of these diplomatic settings, they're able to see the work on the ground. So we have done a number of trips when we can get on their calendars, right, with our leadership in the department and with leaders across our operating divisions, across all of those agencies. So our CDC director, our FDA director, we have our Assistant Secretary for Strategic Preparedness and Response. They've all shown up in these places so that they can see, okay, well, who are the researchers on the ground, right? What are the barriers to regional manufacturing, and what can we help unlock? What kind of conversations can I have with community leaders or health providers? What do the labs look like, and what's missing and why? Those interactions, right? That real life experience, it's irreplaceable.
So HHS is many times known as a domestic agency. Our focus on healthcare access, negotiating drug prices, Medicaid and Medicare, but we've been a participant in the global space for many years. What do you think differentiates HHS global work from other agencies that might be more well-known for their international work?
Yeah, that's a really great question. I mean, I have to say, I truly admire all of the work that happens internationally across the U.S. government, including in the health space, and liaise very well with my counterparts in the U.S. Agency for International Development or the U.S. Department of State. I see someone from White House here, Dr. Nelson, who's been on detail with our National Security Council. So that is a good thing. And I think what they see as our value is we are, first and foremost, we have so much talent and expertise in our building, so to speak. Across our 90 some odd thousand employees in the Department of Health, people have worked and committed their lives to this. I mean, they are the cream of the crop when it comes to regulatory issues or disease surveillance or aging, right? I mean, and it gives us the opportunity to get a head start on these relationships and these agreements that we can make with other countries. In other words, someone will have an idea in another part of government, and they don't have to start from scratch. They can pick up the phone and call us and say, hey, who do you know over there who is working in mental health for adolescents or is working on the fentanyl issue? Because we need to have this conversation with X country or Y organization outside of the country. So that I think is a huge added value and a unique contribution of our department. I'd also say, it shouldn't be lost on people how credible we are when we talk about how we apply this work back home. We're doing the work at the Department of Health. So we're not just showing up in countries asking, okay, how can we help you with all these problems? We're actually showing up and asking, how can you help us with some of these problems? Because guess what? We have Black and brown women dying in childbirth at alarming rates, at rates on par with what's happening in other countries, right? We're dealing with climate crises, floods, fires, heats, pollution, right? In the same way that people are abroad. In fact, people outside our borders are shocked to hear some of the things that we are still dealing with in our country. And so that unlocks quite a bit, particularly when it comes to health diplomacy, to have that personal, again, coming back to that personal connection.
So kind of in that same vein, and we've mentioned this a couple times, that this is a health and human services strategy. And sometimes I think the human services portion is lost with kind of all of the big splashy health things that we do. But how did you leverage HHS human services expertise, and what part does that play in this strategy?
Yeah, well, I mean, we could have a whole conversation about this, but something else that I'll walk away with, a memory that I'll walk away with from my time here, is the way that HHS worked, again, with our Department of State and other parts of government on refugee resettlement. It's incredible the work that we're tasked with doing, the services we're able to provide, or ways we're able to support people who enter our country for the first time after so much has happened to them. And as part of our visits with leadership, with the Deputy Secretary in particular, we were able to visit the International Organizational Migration Campus in Nairobi, Kenya. And we have one of our attaches here from Kenya as well, who helped us arrange that. And it was really incredible to understand the ways that CDC and other parts of our department sort of prepare those individuals to come into the U.S., but then importantly, as they arrive, provide a sort of suite of services and essentially a soft place to land so that they can survive and thrive, right? So that they can contribute to our society in ways that are meaningful, sure, but that they can be healthy and whole in that process. And so I think it's quite powerful how we can bring all that to bear in our international work.
So we have time for just one more question.
Okay.
And so to tie it all up on the strategy, why now? We're coming to the end of your tenure. Why was it important to make sure that this strategy was published?
Well, this is not the answer you think it is. I have to be honest, coming in essentially day one back in 2021, one of the things the team said to me first is, we haven't updated our strategy for some time. We haven't brought current what it is we do. We've been doing all this work, right? We've been evolving, but no one knows it. And it would be really great for people to understand where we are today. And that resonated. And, we were still dealing with COVID and then plenty of other things. But I had made a commitment to our team and to our leadership, frankly, that I would work with them to present their present and to ensure that people understood where HHS global activities are now. Again, I mentioned climate and other issues that are really coming to the fore. I mentioned artificial intelligence, for example, but even just think at a basic level, the way information moved 10 years ago is not the way information moves today. And we have to keep up with that, right? It's the same with certain medical and other technologies. And so it behooved us to really focus on sort of what the status or what the current context is today. I think another important example, and this draws on my personal experience, is how we approach disease burden even. There's been so much of a focus on infectious diseases, and understandably so, and COVID continued to take up a lot of space in our time, in our collective time in this administration. But I, having been someone who worked in non-communicable diseases, was very interested in how we could be a part of advancing that objective as well. And as for some of the surprising things HHS does, there's a lot of work across the department in areas like cancer, heart disease, diabetes. By the way, the things that are actually killing people all over the world, right, including in Africa. So we've long since been saying, this is where the disease burden actually is. And it's not to discredit or otherwise say we don't need to be doing the other work. We absolutely do, because progress still needs to be made in some of those other areas. But we are going to save a bunch of lives from infectious diseases only to have people sick or dying because of these other issues. And so we also, as part of this strategic update, really tried to lift up the evolving nature of our work and the need for us to keep in mind the both and of the health spectrum and all that there is to do. And guess what? We can do it.
Yeah, and I think one other important part that I know that we've talked about a lot with this strategy is just ensuring that equity is based and baked in, and that framework continues to move forward. And that's been important to highlight and lift up as part of the work that we have been doing, and that we hope to continue to see done.
Absolutely.
So I want to thank you so much today, Assistant Secretary Pace, for being able to be with us, be in the United States, but I know you're all over the world all the time. And I'm happy to pass it over to my colleague Kaya for some more HHS subject matter experts to talk more in depth about strategy creation and implementation. Thank you.
Thanks for that fantastic first panel. I'm really excited to have some of our colleagues from HHS here. We have one colleague on the way, and I told her we are ready to receive her as soon as she gets here. So hopefully she'll make it before this session is over. But I'm Kaya Lewis Atkins. I'm the Chief Advisor for Policy and Strategy at the Office of Global Affairs, and really happy to be here today. And so happy that our strategy is finally getting released. I wanted to introduce who's here with me on stage right now. I have next to me Amy Lin. She is our International Partnerships Lead at the Advanced Research Projects Agency for Health. We call that ARPA-H. It's our newest, I think, agency at HHS. So really excited to have her here with us. And next to her is Julia Lamage. She's the director of the Office of Strategy, Policy, and Requirements at the Administration for Strategic Preparedness and Response, which has been at HHS a long time, but it is a newly become operating division at HHS. So we're really excited to have you here with us. So I wanted to ask you all, first, I wanted to thank you all for everything you did to help us with the strategy. It was a department-wide effort, and Julia and Amy and their colleagues were really involved in helping us, so thank you. The updated strategy, as Alyssa and the Assistant Secretary were talking about, really talks about the breadth of the global work that we have at HHS. I'm curious if you could talk to us about one area of work or program in the global space at your agency that you think most people might be a little surprised to know. I'll start with you, Amy.
Sure. Thank you so much, and such a pleasure to be here. Thank you for inviting us and allowing us to provide input into the strategy. It's very exciting to see it out. You mentioned that our agency is very new, and we're only 2 years old, so I do think we're the newest. And one of the aspects that is really unusual, I think, about our agency is how disease agnostic it is. So we're not focused on one condition, but really focused on transformative health breakthroughs to improve health outcomes for everyone. And so that could be capabilities or technologies or platforms. And so we do that by bringing in program managers who are really driving new ideas for how health breakthroughs could be developed, and then seeing how they can fund performers or implementing partners to really carry that through. One of the things that we do at ARPA-H is actually try to find input and expertise from outside our agency and increasingly outside the US. And so one of the aspects that might be surprising is that we've actually built ARPA-NetH, which is an innovation network of over 1,000 members that brings together the private sector, academia, nonprofits, and others, and from all 50 states and DC, but also from outside of the US. So we can draw on that collective knowledge and wisdom to inform how can we make sure that the innovations we're investing in are really designed to the needs and desires of the end users, so that even if we prove that it works, somebody actually wants to use it. And even if it works and somebody wants to use it, that the marketplace will sustain it. And so how can we make sure that the business model surrounding those innovations carries all the way through? So very recently, actually, I think it was Monday, but maybe it was the week before, because time is a warp these days. We just launched a partnership with the FDA on a medical imaging marketplace. And we had already collected feedback through this ARPA-NetH innovation network from all different places to better understand how users, producers, and developers of medical data engage with that data, whether it's pathology data, radiology screens, et cetera. And then we took that input, used it to inform this new initiative that we just launched, and that is actually open right now for ideas. So we're trying to hear from the world, hear from across sectors, take that input to shape our own investments, and then issue them accordingly.
Fantastic. It's such a great example of what the Assistant Secretary was saying, which is our work is not just about what we're doing or offering to other people around the world, but how we can partner and what we can learn from them. It's a great example of that. Julia, how about you?
Great. Good afternoon, everyone. Again, I'm Julia Lamage from the Administration for Strategic Preparedness and Response, or ASPR, at HHS. To take a quick step back, for those who are not familiar with our agency, ASPR's mission is to help the United States prepare for, respond to, and recover from all manner of public health emergencies and disasters. So that includes everything from hurricanes to emerging infectious diseases to terrorist attacks and everything in between. As such, our programs, which are mainly domestic focused, but range from everything from disaster medical teams that go out with FEMA after a natural disaster here in the United States, to a wide range of medical countermeasures programs. So we have centers within ASPR that do everything from advanced research and development of medical countermeasures through stockpiling and distribution and use. We also have some work shoring up manufacturing and the supply chain to make sure that we have access to those countermeasures. So just saying that what I think might surprise folks a little is how much we're able to do and how much an impact we can have at ASPR, even without sort of a standalone global program, right? We don't have personnel on the ground overseas. We don't have funding dedicated to that mission, but we're still able to make a big impact through sharing expertise in bilateral and multilateral forums with a range of partners on everything we do. And I'll talk about it a little more later, but also I think some of the investments we've made in our domestic programs have really made a big impact overseas as well. One quick thing I also wanted to highlight, we did recently, just this September, host a 25-member World Health Organization external expert evaluation team for 17 countries. So I have to read these numbers to get them right. But, and again, this was the U.S. Joint External Evaluation of the International Health Regulations technical capabilities. So really a holistic look at how we here domestically are doing against all those capabilities, really to show our support and emphasize how much we support the IHR, and was just a great experience with the representatives from those 17 countries being able to share lessons and best practices across the group. So thank you.
Fantastic. And again, an example of how we view our work as global work, and the United States is a part of the globe. And so being able to share and even have our work here in the United States be evaluated by people from around the world, but so that we are in, we're saying that we care about what we're doing. We care about how we're working with other people. And it's not just about us funding things in other places. It's about being a part of that global community. I'm very happy to have it. This is good when you have a little bit of extra time, right? This is Andy Fristed, and she's the Deputy Director and Chief Strategy Officer at the Centers for Disease Control. So Andy, just take a quick breath. We are now talking about some of the work that you think in the global space that you think people might be a little surprised to know that happens with the CDC. Welcome. Right there. There you go.
No? Yeah. Okay. Well, good afternoon, everyone. I'm so excited to be here and excited to be with my colleagues. I apologize for walking late. It's a very exciting Friday here in Washington, D.C. But this is so exciting. And I just want to start really by recognizing Assistant Secretary Pace, Kaya, all my HHS colleagues, but it is so special to do this work as part of an HHS family, and the leadership in pulling together the strategy, which I think, I'll just say, I think this is like, I don't know if Kaya slept a lot like this year, I don't know. But to have her pulling us all together in this work together, and this is when you join a panel and you didn't hear what your colleague said, you can just start wherever you want.
We'll cut you off.
Yeah. And it's just really special. So I'm happy to be here. I'm so grateful for your leadership, and for all of us being able to do this together. Okay. What's surprising? We do a lot. All of us do a lot. So I think there's a lot that's surprising, but the place that I want to start is, and this might be like not what you're expecting from CDC, which I guess is the point of the question, is to talk a little bit about research, right? So we are, of course, on the ground, expertise, doing the shoe leather public health every day. But we are also doing so much work at CDC investing in operational research around the globe. So maybe I'll just provide a few quick examples of things that I think are exciting right now. One is really important research we have been doing around a novel urban dwelling mosquito that some of you have probably heard about that is making us very nervous about what does it mean to have mosquitoes in these new places behaving in new ways. 26 million new people at risk for malaria. Really important research we've been doing to make sure that we are mitigating that new threat. And maybe we'll stay on the mosquito theme for a minute, thinking about what can we be doing? I think a lot of folks have been reading about dengue in the news. We have been really focused on new research innovations so that we can infect mosquitoes with common bacteria that make it less likely for them to transmit dengue to people, right? So really exciting innovation. Next generation sequencing, huge advancements that we've been able to make around the world. Maybe I'll name Vietnam and Cambodia, especially really excited about the work that's happening there and the promise for that in particular around avian flu. AMR is a place where we've been doing a lot of research, thinking about how can we be bringing new detection strategies to bear in our global health work when we think about antimicrobial resistance. And maybe the last one I'll mention is wastewater. So I think a lot of people have been reading about the work that CDC's been doing on wastewater domestically. Really important technology that I think 5 years ago, no one knew about. If you said wastewater surveillance to someone 5 years ago, they'd be like, I don't know what that is, but I don't want to do it. And now everyone's like, wastewater surveillance, that's so great. It's so exciting. And it is for us here in the States, really important work, but also that we've been doing research on how to use this globally and applying that around the world. So I'm building capacity. We have 3 regions around the world who have been able to build that wastewater capacity thanks to that research work. So I don't know, it's kind of surprising, right?
Great. Yeah. Yes, I remember first hearing about it, and I'm just like, this is very interesting. Okay, so I'm gonna move us along. Amy and Julia, I have a question for the two of you. One of the key things we updated in the strategy is really focusing on the innovation and technology work that we're doing now. That really wasn't that present in 2016 when the last strategy came out. Can each one of you talk a little bit about the role that innovation plays in the work at your agencies? Maybe Julia, I'll start first with you this time.
Sure. Yeah, happy to chime in on that. So, obviously we like to innovate across the board, but what I will focus on, we do have an entire sort of research and development arm in ASPR. It is the Biomedical Advanced Research and Development Authority, or BARDA. And so I think, BARDA has really been a leader in responding to numerous international infectious disease outbreaks. Because of innovation and a lot of work and funding, honestly, in the past, they've been able to make vaccine and therapeutic options available through donation and clinical trials to outbreaks overseas, as well as to those obviously in the United States. Something they've been really successful in, right? So we've spent, we put a lot of resources into our domestic capabilities, but BARDA has also been able to work with regulatory agencies across the entire world to get approvals and authorizations from kind of the respective regulators so that folks in other countries are able to use these countermeasures abroad. I think they're coming up soon on 100 FDA approvals for BARDA products, which has been a real success story of the last couple of decades there. They do have an entire arm focused on kind of innovation. It's the Division of Research, Innovation and Ventures, or DRIVE, the BARDA DRIVE program, with a wide-ranging portfolio. And just sort of an example of their things they're doing there that are relevant. They are partnering with a company for early product development of a rapid point-of-care diagnostic that distinguishes between both the Zaire and Sudan Ebola viruses and malaria, which is really important on the ground in places where some of these diseases are popping up. And just a couple notes here. I mean, I think they've been able to do some really amazing things during the recent outbreak of Marburg in Rwanda. BARDA was able to get countermeasures over there in less than a week. And I mean, they're still in trials, right? Not fully approved, and we sent them over through those processes. But it was amazing, and really the reason that was able to happen was because of many years of work and over $300 million of investment from ASPR, from BARDA, into those countermeasures, those vaccines, those therapeutics that had already been brought through phase 1 safety trials and were ready to go when they were needed. So highlight that.
Thanks. That long-term relationship, investment on the ground, diplomacy, all of it makes a difference in a crisis. Amy, how about you?
Well, we don't have the long term yet because we're
Not
only
yet,
2 years.
but
old.
the ARPA-H is like all about innovation and technology, right?
Exactly. So I was going to say we don't have the years of experience behind us yet, but innovation is our lifeblood. It is the guiding force that shapes all of the work that we do. And is really focused on how can we as an agency help enable breakthroughs in health that can't be done through traditional research and development systems, and also won't be adopted by the private sector yet. So maybe it's outside of the mandate of our fellow colleagues or of academia, the ways that they're currently prioritized, or it's too risky or unproven for the investment community or the private sector to adopt yet. So that's really our sweet spot. And what could that look like? 2 quick examples is one related to AMR that was mentioned earlier, and then also another focus on women's health. For AMR, or antimicrobial resistance, we have 2 projects. One that was recently announced called DARTS is really focused on how can we very quickly understand what microbes are in a sample and what antibiotics would they respond to. So a very rapid, highly accurate antibiotic susceptibility test that is much more affordable and much more portable than currently on the market, and hoping to pair that with another project called Target that uses artificial intelligence, which I know Assistant Secretary Pace mentioned earlier, to leverage machine learning and artificial intelligence to very quickly develop new platforms of antibiotics so we can get ahead of resistance and build out that pipeline. And then on the women's health side, as I mentioned earlier, we know that we need to find new ideas and radical solutions everywhere in the world. Some of them will be in the US, but some of them will be outside the US. And so we issued a $100 million challenge called the Sprint for Women's Health, really asking for the world's best ideas and how to address health conditions that disproportionately affect women. We received over 1,700 responses, including from 34 countries, and we awarded over 20 awards, including several to international headquartered organizations. So I think that just really reflects how we are committed to very transformative innovation, that we're thinking about it in different ways of leveraging technologies like artificial intelligence, but also leveraging the widespread genius that is spread everywhere in the world, and trying to find those best ideas and put commitment and funding behind them.
So cool. You know, people often think government works slow, but these guys are there to move fast. And we need all of it. Andy, last question over to you. One of the 4 main goals in the strategy is about global health security. So I was hoping you could tell me a little bit about CDC's work in the global health security space.
Yeah, well, thanks. This is such an exciting area for us and a place that we spend so much time. And one of the things I want to maybe start with when we think about our global health security work is how we think about the continuum of our domestic to global work at CDC. So obviously huge parts of our work at the Centers for Disease Control is domestically focused here at home, investing in states and communities across the country. But when we think about our global health work and our global health security work in particular, it is informed by what I think is totally intuitive to everybody in this room, probably, which is that you can't just be focused on home to keep folks here at home healthy, right? So we know a disease threat anywhere is a disease threat everywhere. And so that's why we have this really important focus on stopping threats in their footsteps abroad, right? We want to make sure that that things are stopped at their source before they ever come and pose a threat to folks here at home. Now, we can care about the health and safety of people globally and care about the fact that that keeps people healthy and safe at home at the same time. I think that's such an important point because I think sometimes we go in the global health security space and we say, yeah, it's really important to do this work because it protects Americans. That is true. And it protects people around the world. And that balance and that duality in this work is so important. And it also means that doing this work, engaged in a global way, it helps inform us, right? I think this is such an important point. You know, I was at an event this week with Senator Cory Booker, and I don't know if he was quoting someone else or if I'm now quoting him, but he said, you know, genius is distributed equally around the world. And, you know, it's so exciting to like hear this work because I think it's such an explicit recognition of that and of the fact that, you know, CDC has the world's leading experts on every known threat, but we have plenty to learn from others around the world too. So our global health security work also means that we have that sort of exchange of health, but also that exchange of knowledge. We have been thinking a lot about our work as the extent to which we at CDC are a national security agency and that this is national security work. And that is because of the health security piece of it, but also because of the really important aspects of health diplomacy, right? We know that public health work gives us a way to outstretch an arm to our partners around the world, build relationships that both advance and promote public health, but also advance and promote our standing around the world in such important ways. You know, part of, for us at CDC, what I think helps us really do this global health security work is our scope, right? So we've been doing this work for 70 years. We have more than 60 offices covering more than 110 countries around the world. And that combined with this expertise means that we so often are the first call when something mysterious or something known and scary pops up wherever it is around the world. And that is so important for this sort of health security orientation. And maybe I'll just take one more minute to just give a quick example, which is what's happening or has been happening in Rwanda around Marburg. So we had a recent situation that many of you probably read about of an emergence of Marburg, which is a viral hemorrhagic fever in Rwanda. And we've been working in Rwanda, had an office there for more than 12 years, been working on HIV, on TB, on malaria. So we've been investing in the public health infrastructure and we've been investing in the relationships and we've been building trust. We've been building systems and we've been building trust. And those go hand in hand when we think about global health security. And so they picked up the phone and they called us and they said, we need your help. And so we put our best and our brightest on airplanes. We made sure that our folks that were there were working shoulder to shoulder with the Rwandans to make sure that they had the support that they needed from us in their response. And in 9 days, we had vaccines into the arms of healthcare workers in Rwanda. And that is not what every story of outbreak looks like over the years, even over the recent years. And we can do that because we have been investing in this global health security, because we have been building on the foundation of these investments over many years, and because the trust and the relationships are a central part of that work.
Thank you so much. Thanks to all three of you. And it's such a perfect segue into what our next panel is going to be, talking with our health attachés who are out there around the world, sometimes a part of those first calls and first moments. We have time for maybe one or two questions if there are any. If there are, can you come up to the mic, please? Thank you.
I'm all scared of this because I'm so short that it would always look ridiculous. Hi, my name is Carmen Pan. I'm a global health reporter at Politico. Because you mentioned mysterious outbreaks, there's one mysterious one as of the time of speaking happening in the DRC. And I was wondering if you have any more information and if the CDC has people there trying to identify what's going on. Thank you.
Yeah, sure. We are hard at work to make sure that we know exactly what's going on there. We are in touch with our folks who are there, in touch with colleagues both in country and multilateral partners. And, I think that it is, as you indicated, I think there are still some questions about whether this is something, we have signals all the time in countries around the world where things pop up and we think, okay, what's going on here? And then we work really quickly to figure it out. And we are in that moment right now in DRC of working really quickly to figure out, is this something that is routine and we need to make sure we're addressing right away, but nothing surprising, or is there something sort of new and different going on? So we're hard at work and we'll make sure to keep folks posted.
Thanks.
Hi, Peter Maberduke, public citizen. NIH, BARDA, other U.S. government institutions invested fantastic federal money in science, leading to the development of incredibly effective vaccines against COVID, amongst other diseases. The NIH Moderna vaccine helped save millions of lives, along with the other mRNA vaccines. However, more lives were lost after the introduction of vaccines than before. Millions of people lost their lives due to not having access to those vaccines. In our view, the United States had considerable power to insist on affordability and access measures so that those vaccines were not more expensive in Southern Africa than in the United States, for example, and so that others could manufacture the vaccines. How do we do better in the future? How do we make sure that federal investments in science and scientific advancements are available to the people who need them when they need them? Thanks.
Hi, my name is Luke Zarzecki. I'm a reporter with Inside Health Policy. And I'm really curious about what the incoming administration might mean for bird flu in regards to some of the rhetoric around funding for the CDC, HHS, and all of that.
As far as vaccine access and investment, who'd like to take that?
I'm happy to start. I think your question stemmed from the recent situation around vaccine access, but it is broader in terms of how do we make sure that any innovation breakthrough is available to all of the communities that need it, whether in the US or outside. And I think it's an important question and probably a very multifaceted answer. It's going to take partnership, the long relationships that Andy was just describing, and it's going to take planning. And so each innovation will need its own set of partnerships and tailored planning to make sure that that is thought of in advance. And so for any type of device or drug or antibiotic susceptibility test or anything else, how do we make sure that the data, the samples, the clinical trial participants, all of the data that we're using to develop those innovations are as diverse as possible and reflective of as many different settings as possible? How do we think in advance using our relationships to understand what are the criteria for deploying those innovations in other settings, whether it's a variety in the US, rural, urban, desert, mountain, everything, as well as outside? And how do we plan for those steps to be in place at the beginning? And part of what we're doing at IRBA-H is trying to institutionalize that planning and build those relationships from the beginning. So we have an office dedicated to transition of innovations to real world use. And it's called PATIO. The acronym is PATIO because we always have to have an acronym. And that is working with every single program manager to think through, how will your innovation get to the real world? How does it interact with the different parties that need to be using it eventually? And how can we think about this access at the end after we've already proven that it works? So I don't think there's a single answer, but I hope that by planning in advance and building partnerships in advance, we can get closer to that for each innovation.
Great. And then very quickly, we certainly can't speak for what's going to happen in the future, the next administration, but would anyone like to jump in just a little bit on bird flu?
Well, I can't talk about there's
wastewater
the
and
future.
bird flu.
Yeah, I mean,
Right
I
here.
can always talk about wastewater.
Bird flu.
But I can talk about some things that we know now. I mean, the question was about investments, right? And we do know that that there is a House Appropriations bill that cuts 22% from the Centers for Disease Control and Prevention. So we don't need to know what a future administration would know to understand what that would mean for our work at CDC. And, I'm speaking for CDC, but of course we do all of this work in partnership with our HHS partners and with our interagency partners across the USG. And so we are seeing, I would say, a sort of clear and present danger when we think about what investments in public health look like. And anyone who sort of follows public health and the dollars around public health knows that there has been in global health and in public health more general, this sort of investment and neglect cycle, right? Where you see there's this, something like the pandemic comes along, the COVID-19 pandemic, we see these massive investments and we build incredible things with those investments. I promise, Kaya, I won't get into a whole thing about like the public health data system that we built at CDC with those investments, but it's real, but it has to be sustainable, right? So when we think about our global health work, everything that we have built takes dollars to continue, right? It is that sustainability, making sure that we have the resources we need to make sure that we have the sort of flexible, innovative, sustainable public health programs on avian flu and on everything else is important. And so I think it's an important question and one we're thinking a lot about.
Excellent. Thank you all very much. We're going to keep moving to our next panel. We have Susan Kim, who is the Principal Deputy Assistant Secretary of Global Affairs, who will be conducting the panel with our health attachés from around the world. So I'll bring them up right now.
Right. Good afternoon, everyone. Thank you again for being with us. Okay, got it. Thank you very much. So we are very excited to have this second panel with our HHS health attachés. There is a description in the strategy, but briefly, this is our small but very mighty cadre of seasoned health experts and diplomats that are stationed at 7 strategic posts around the world. And, in terms of the sort of why now question, sometimes I think the stars align. This happens to be the end of their home week in DC. So we are very lucky that we were able to get some of them to join us for this panel. So briefly, I am joined on stage, starting from my left, by Dr. Sophia Siddiqui. She is our health attaché based in South Africa. Prior to being stationed there, she was a researcher working on emerging and re-emerging diseases, infectious diseases at NIH in the areas of Southeast Asia and also Africa. And then to her left is Janessa Georgie, who is our health attaché in India. She has had a longstanding career both at OGA and CDC, and she's been at previous posts in Vietnam and Tanzania. And then also that Dr. Matthew Lim, who is currently our attaché in Geneva. He has had a longstanding career within the US Navy, DoD, WHO, and is now in Geneva. And then finally, Dr. Desmond Williams, who is currently our attaché in Kenya. He's also had a very long-standing career at CDC, where he's been at posts that include Ethiopia, Liberia, and Sierra Leone. So we're very lucky to have them with us. And I also want to acknowledge we do have a few additional staff, including our deputy health attaché, Sophia, in Geneva. Ms. Sophia Kovac, as well as some of our local staff who is also in the audience as well. So I will kick off with the first question, perhaps to Sophia and maybe Janessa and Matt, which is, as health attachés, you work with embassies and in-country partners on a wide variety of issues. Can you tell us about a time where you felt your diplomacy at the country level was particularly effective?
Yeah, this one's working.
Good afternoon, everyone. Pleasure to be with you. I'm going to get right into the question so I can answer more of that. Yes, I can definitely recall in the very recent past a pandemic that we all went through, the memory of which is actually fading fast. And during that, when some of our African scientists announced the Omicron variant, we, among other countries, put travel restrictions on Africa. I don't know how many people recognized at that point that this was going to be South Africa's first tourism season after 2 years. And the country relies on that tourism for a lot of its economy. So as that came on, I think the only message that entire 24 hours on my phone was lift the ban. This actually really created a very difficult bilateral situation for us in the country. So I read on the wall, the waging of peace. This was a moment of the waging of peace, and that comes in all sizes. You could call this a mini one if you like, but it was going to be a very difficult one for a bilateral relationship. So in partnership with the embassy's leadership, we agreed on a diplomacy outreach plan and started reaching out to our key partners in the Ministry of Health and Foreign Affairs before they got to us. And started to talk to them about their concerns and made sure that those concerns were coming back. I think part of that good partnership and diplomacy is that we reach out before our partners are so upset that they won't even speak with us. And so we also were very lucky with Lois and to get our secretary on a call with the Minister of Health of South Africa to talk about his concerns and very quickly relate them back. We kept doing this over the course of the next few weeks. And I do think that some of that, coupled with our public health scientists really understanding the emergency this had created, working round the clock, so that within less than a month, I think, those travel restrictions were lifted. Thank you.
This work? Wonderful. So I'll just add, diplomacy can look so different. So it can be big things. It can be, large negotiations, where people are sitting across the table and saying, well, we want this line or that line, or it can be so small. I don't even know if you'd call it really, diplomacy, but are often the foundation that you lay that allow larger, bigger things to occur. I remember when I was first told about the cancer moonshot, the Biden cancer moonshot, this idea that we wanted to partner globally with, particularly with India. The Prime Minister Modi came to the U.S. and there was an announcement that we're going to partner in cancer. And so then it was, my first, week, in India, and we're wanting to say, okay, how are we doing that? How is this going to look? How are we going to partner? How are we going to build on what we've been doing for decades, but do something bigger than that, larger than that? And so it was going to every NIH partnership we had in cancer, talking to the researchers on India's side, hearing what was working, what was not, what did they want to see, if we're really going to aim for the moon, and beyond, what does that look like? What is that partnership? And then having those discussions with Department of Biotechnology in India about, what's possible, what's there, where do you want to see these big ideas come from? And, this kind of just the foundation was so important that when, there was an announcement on a date that we were going to do a dialogue, and India is like, well, that doesn't work. No, that's not possible. And, we've got 22 people who've already gotten their visa, we're going to be on the plane, that we're able to then pull those levers of the relationship of what we've been able to build to be able to say, then be able to say, okay, yes, no, we can make this happen. We can rearrange, we can keep Parliament at bay for a little bit to make this happen. And additionally, then when we took that, from that, had a wonderful U.S.-India bilateral cancer dialogue. And then we wanted to take it, well, that was great, but we want to do more. We want to have a relationship with a regional relationship on cancer, and we want India to make these commitments. And they're like, but we just did the bilateral. We just got all these things. We haven't even implemented it yet. How can we do more? It was having those same, relationships and conversations, but it was also taking a step back And there was at one point where the US government had sent me, the interagency team had sent me a thing of like, we recommend India do all these things. I took that piece of paper and it had it had Australia's commitments, it had, the US's commitments, it had Japan's commitments. And I just deleted all of India's commitments and handed it to the Ministry of Health and say, what do you want to put in there? What do you want to commit to this? This is, we're doing this together. This is part of a joint collaboration between the 4 countries. And some of it's a little bit stepping back and saying, what should this partnership look like? And them having that voice to be able to say, we want to do this, we don't want to do this. Some of the ideas they came up with were the same. The US government, Australia, and Japan thought India should do, but some of them were different and better and more creative and more enabled India to be able to really fully commit at the table about what they wanted to do. And because of that, as we're seeing, the next stages in the Quad and regional relationship on cancer, there's ownership there. And so they're going to be the ones pushing the US, and to say, we want to do this in cancer. We want to keep this discussion going. They're the ones still calling me every single week saying, you haven't done this yet. You agreed we're going to do this part of it. And that's really what diplomacy is in a really fun, exciting way, in a small way, but where there's so much more we can accomplish together.
Oh, I'm happy to give a stab at answering your questions, but because I don't mostly work at the bilateral country level, would you like me to give a stab at an answer, or should I pass the mic to Desmond?
Well, I actually think that's a great segue. We can move on to the second question. Maybe we'll start that direction, which is, I think, as has been described, the health attachés also represent US policy positions and can influence negotiations happening with multilateral partners. And what have you learned about how your work or your relationships multilaterally or in country can influence what's happening at the regional or multilateral level? And we'll start with Matt and Desmond.
Yeah, I was trying to think of an example. I've been working in Geneva and the health attaché role for about 1.5 years now. And I think probably the most exhausting but also invigorating time of that past 1.5 years was the last World Health Assembly, where we passed by consensus the amended package of the amended IHR international health regulations. And I think for those who aren't really following this, I mean, it probably wasn't that advertised in the press, but this was really a triumph of American leadership across multiple offices and across multiple U.S. government agencies. Because I think in the midst of the COVID-19 pandemic, it was recognized that the IHR 2005, as important as they are, were not sufficient for the needs of the moment. And so it was really the U.S. government, together with partners and allies, absolutely, part of a coalition, but it was really the U.S. that drove the initiative to reform IHR. And of course, when we go into these negotiations, we do it because we identify that there's something for the benefit of the United States in a better outcome to this negotiation. We don't do this because we're just trying to find work for ourselves. We're doing this because we think that there's something here to be gained for the American people, but we also do it on behalf of the world. And so it was really fascinating watching all these countries come together, debating the IHR. And there's a lot of suspicion about the United States because COVID-19 was a very divisive time. And there were a lot of different ideas about what was necessary and who was going to pay and what are we going to commit to and so forth. And so there was a lot of back and forth within the U.S. government interagency and with our partners and with frankly, our adversaries in the room about what could we get to. And so I think the thing that I really remember from this time, and I was actually really a bit player in all this. I mean, it was a huge team effort, and I was by no means the principal member of the team. But as time got closer and closer, and the hours got later and later, and we were like 2 o'clock, 3 o'clock in the morning in that airless room in Geneva, and you're establishing those relationships, right? And some of them are adversarial relationships. You know, it's 2 o'clock in the morning, and people are saying, "Oh, my country will never accept this. Absolutely not." And we're phoning back to Lois and others saying, "Lois, can we accept this deal?" and so forth. The thing that I remember is that it took real leadership on the part of many people, Lois and others in the US government, to say, this is a deal we can accept. These are things we must have. These are things we can be flexible on. And it takes real courage to sort of say, where can we show that we are finding common ground? And so then this negotiation went right down to the wire, right down to the last day of the WHA. And I recall right to the last day, it was not clear that we would be able to find common ground with Russia, China, Iran, and so forth. And we posed the question back to HHS leadership and said, we're at that sticking point. We can either hold to these positions because they're very close to our heart, but they might jeopardize the deal. But if we want something for the world, we think it's possible, but we're going to have to give a bit more, a bit more. Do you want us to give a bit more for a better deal for everybody? And we got permission to give that bit more. And then, because we'd worked with all these partners, and because of the excellent work of our technical support, CDC and other units who people knew their reputation, they knew they were trusted, right? They said, okay, if the Americans are willing to give that bit more, okay, we have a deal. And that was really an amazing moment. That was more than my 2 minutes, I think. So I'll stop there.
Thank you so much. Des.
Yes, thank you very much, and good afternoon, everybody. Thank you very much for being here with us. Congratulations to Lois and others, to Assistant Secretary Lois and also Kaya, and actually launching the global strategy. So in answering this question, I want to step back and say that as health attachés, we're the tip of the spear representing the whole of the HHS agency. But also, we're also in many ways the glue for the interagencies that we have at Post. So that puts us in a unique position to be able to influence what's happening, not only in the countries in which we serve, but in ways in which the regional multilateral partners that we work with actually act and vote. Without going into too many details, because of course we do not want to divulge all our techniques, I will just say that relationships are key. And developing strong, trusting relationships needs to be established before we can even walk into these negotiations. Like Matt was saying just now, those relationships that not only we as health attachés, but also our operating divisions have developed over many, many years of interactions with these host governments are extremely important. And then once you have, and they need to be established before a crisis or before an issue. You can do so during a crisis, but it's a lot better when you already have an existing relationship with them as you walk into a crisis or an issue. And once that trusting relationship is established, you need to work really hard to maintain it. Trust is difficult to achieve, and it's very fragile and can be easily broken. But in the end, you need to be present and relevant when decisions are being made or positions are being taken to be able to influence that decision and that multilateral organization. So I am in a bilateral relationship with Kenya, but also Kenya has a very strong relationship in Africa and is one of the strong voices for the Africa Group on a number of important negotiations that we were negotiating over the last year. So imagine my surprise when I woke up one morning, I walked into the office with Clara, who was also from the Kenya office, and we got a message from HHS that the assistant secretary needs to speak to somebody. I think you sent that to me, Susan. That the assistant secretary needs to get in touch with somebody within the Kenyan government before the negotiations of a particular article. And so, because of the relationship we have with these individuals, and also because of the fortunate geographical advantage of the 8-hour time difference between open up business in Kenya and open up business in DC, by the time the assistant secretary woke up, we had that appointment, we had that call. A very interesting call. I can't get into some of the details of what was discussed. But at the end of the day, by the time we finished that 1-hour call, the assistant secretary and also the Kenyan government individual was already in a place where we understood what our individual positions were and also understood exactly how the negotiations should proceed to actually get and achieve an outcome. So those are some of the things that we do. But we also do a lot more. It's like, for example, you asked the question about this issue in DRC. Yes, we're trying to investigate that. And guess what? I've already contacted the WHO Afro regional office in Congo, Brazzaville, to try to get information. I also know the WHO has deployed a team to do an investigation. I'm hoping that the relationships I have and we have would enable us to be able to get to the bottom of that as quickly as we can, so that then our operatives can then start responding if we need to that particular outbreak. So those are the ways in which we being out in the field, working shoulder to shoulder with our host governments and other multilateral partners can assist the US government in advancing our goals. Thank you.
Thank you very much. So I think just being mindful of time, do we have time for a couple of questions? 1 or 2 questions from the audience. So if anyone would like to ask, please, I think you can come up to the mic right here.
Hi. About 8 years ago, I led a review at USAID, and the title of it is telling. It was a review to determine the effectiveness of the USAID's ability to coordinate international health emergency response. And that's because USAID was actually asked to try to coordinate the Ebola response. And the result was telling, and principally because of the lack of coordination among the federal agencies, including CDC and others. And so I noticed the mission statement that you have on the Office of Global Health in the brochure. The first sentence is exactly the first recommendation that was made in the report. And my question is, how's the coordination going?
Well, thank you very much for that question. Thank you for your report. Obviously very prescient.
Want to take my questions?
Oh, yeah, maybe, yes. Maybe we take the additional questions as well, so we can answer them at once.
Hi, Karen Ponigan, Global Head Reporter at Politico. I wanted to ask Mr. Lim, there's a lot of concern that this was the year where the pandemic treaty really died. So, and next year we might get the confirmation of that or not. So I wanted, to the extent that you can talk about it from the view in Geneva, where you talk to your counterparts from other nations, like, what's the feeling right now? And, are people really concerned that the US is not going to be part of it come January 20th? Thank you.
Hi, everyone. Thanks so much for a great panel, and congrats again on the launch of the global strategy. My name is Arish Lal. I am wrapping up a PhD at the London School of Economics that looks at the fragmentation of health systems and the ways to build a more coherent and resilient global health architecture. One of the things that I think is so unique about the role of global health diplomacy is the promotion of international principles. And I think one thing that I think the US has done really well in this administration is promoting equity as a cross-cutting priority, and we see that in the global strategy. I was wondering if you might speak a little bit about how the cross-cutting goal or principle of equity has shown up in your work, especially in spaces where it's often not been there, especially in the global health security space. Any examples of how that looks like in your day-to-day work in spaces where equity was never before seen as part of the discourse? Thank you.
Thank you very much. So do we have a volunteer to take the first question on coordination? Does?
Susan, I was going to say, I think we probably just need to go with one.
Okay.
The time is short.
Got it. Okay.
Oh, well, thank you very much for that question. Just as part of the background, I was actually one of the CDC leads for the Ebola response in West Africa. So that was something that I was actually dealing with on the ground at that time. So from my perspective, the interagency works really well on the ground, right? In the theater when we need that to happen. So in that particular instant, we had the DOTS team from USAID, who was the lead of the response, but also CDC, who was a technical co-lead of the response. And so we were working really well together. We had meetings in the morning and in the evenings. We were coordinating all our activities. All the procurement actions that the DART team were being done were run through us, and it worked extremely well. Not only during the Ebola response, but also in the aftermath of the Ebola response. Because you can imagine, when we're responding to these outbreaks, we try to build systems that would survive and endure past the current outbreak that we're addressing, so that we can use those same investments to address future outbreaks. So as a result, as we're scaling down from a response team into normal operations, you had to then map, okay, this is what CDC was doing, this is what USAID and others was doing, this is what DoD was doing to another more permanent responsible party. And we spent weeks working on that, diligently going through every single pillar of the response to know that at the end of the day, when the response was over, that there was a responsible US government partner that was going to be picking up those particular pillars as well. Since then, I've spent time in Sierra Leone and also in Liberia. I've also spent time in Ethiopia and now in Kenya. I have to say, in all of these countries, the interagency work groups have been extremely cohesive, extremely coordinated, and we work together, meet regularly, and we synergize across the group. We identify the niche area for every agency, and we work together as a team to make sure that the support that we provide as a U.S. embassy is as comprehensive as it could be, and also as effective as it could be to provide support and save lives overseas. Thank you.
Thank you very much. I apologize if we didn't get to your questions, but thank you very much to our panelists. And I am turning back over to Dean Hayter. Well, I will make this wrap up short and encourage people to, catch folks for your questions as you're sort of milling out and going out the door and everything. But just thank you once again to our HHS partners, not just for our wonderful show today, but especially the work they're doing every day that is now captured in this global strategy. So one more round of congratulations, please. And I really loved the sort of raison d'etre that Assistant Secretary Pace gave in sort of talking about this strategy. And we do have hard copy strategies in back, which I'm sure will be collector's items in a day of very little print. So grab one now. But the reality is, and I think our panelists just gave you a little bit of a flavor of, there is so much work going on every day from all facets of HHS on issues that affect the health of the world. And, I'll editorialize a little bit. I think HHSers, tend to be the workhorses, not the show horses. It is really hard to get a lot of HHS scientists and experts to actually talk out loud about the great things that they're doing. It's just not in the nature or the culture of what's happening. So I very much appreciated both of the panels with the tantalizing tidbits and descriptions and examples that just very much scratched the surface of how much work and expertise and commitment is happening all day, every day. But I love that concept that this strategy, frankly, it is to both put out that vision for the future, but to elevate and to make visible the core commitments that are already happening every day, both ongoing commitments for pandemic preparedness and security, but also new commitments for exploration of innovation, for digital and AI, and for these sort of next frontiers of where impact will come from, but to elevate, make those things visible, and hopefully be a way for all of us to engage both with HHS and with each other on making progress on these really wonderful aspects as we go forward. So thank you. Thank you all, and thank you all for being here today.